We are very privileged to have Professor Pierce Chow with us today. Professor Chow is one of the faculty members here at Duke-NUS and has appointments in both the Office of Clinical Sciences, where he is Senior Clinician-Scientist, and the Office of Education, where he is a course director. Professor Chow is also a Senior Consultant Surgeon at the Singapore General Hospital and head of the Hepato-Pancreato-Biliary Surgery Team. He is thus one of those uncommon individuals who have dedicated roles as clinician, scientist, and teacher.
Well, as a clinician, the first things I do in the day is, of course, to do a work round with my surgical team. And that is when we see the inpatients. So normally we start about 7:30. But the surgical team will, of course, be on the ground much earlier. So we do a work round. And most of the time, the mornings will be taken up by scheduled clinical activities. And this will include surgery and running surgical clinics, including the trial clinics where I see the patients who are enrolled on research programs and so on. So this takes up most of the mornings. The afternoons tend to be taken up by research activities or by teaching activities. And before we leave for the day, usually we see the patients again, the inpatients. Usually I try to leave by 7:30 and so on. But as you know, the day is usually too short. So a lot of the work is taken back at home, and we do some of the work at home. It would be good if there's more than 24 hours a day, especially if you're doing a few things together. As faculty in Duke, I actually have two roles. I have an appointment in the Office of Clinical Sciences, and that would be in my role as a Senior Clinician Scientist. My other role will be in the Office of Education, that is with regards to my teaching, and I'm course director of the normal body course in the first year. So in that sense, I do two jobs in the school as faculty. It's one of the foundation courses in the first year that students take before they become clinical students. And this is a course that encompasses subjects that in a more traditional medical school would be taught in the subjects of gross anatomy, physiology, and macroanatomy. So in most places, this would be taught as three different subjects. But at Duke, we teach them as a single integrated subject. And the reason is quite clear, because if a patient comes to a doctor, the patient does not present to the doctor with an anatomy problem or physiology problem. The patient presents with a clinical problem. And this divides between what is gross anatomy, what is physiology, and what is macroanatomy is actually quite artificial. And I think for students who are preparing to be clinicians, it's best to be taught in the way they would be practiced in the wards. So that's the unique aspect of that. We're teaching all the three subjects as one integrated course. The other unique aspect of the course is that this course is one of the few courses in the first year that is taught only by senior clinicians. So what the senior clinicians do is that they bring to the course their experiences in the clinics, and because they are senior clinicians, they are able to focus or hone down on subject material that is most important to students who plan to be clinicians in the future. So these people bring their expertise with them and leverage on their clinical experience to teach what is really important. Because in real life, the things that are important has to be taught very well. But you have to know where the rest of the things are, And I think this is what makes the normal body course very unique. And a lot of clinical material is used. So as first year students, the students learn a lot of things that in other places would only be taught in the second or third year. When we started the first course in 2007, what I did was that I looked around for very experienced clinicians who are known to be good teachers. And in essence, I reached into every corner of SingHealth. The teachers come from Singapore General Hospital, come from the Heart Center, come from Tan Tock Seng Hospital as well, and some of them are in private practice. So these are individuals who have a track record of being very good teachers and who are very keen to teach, because we are starting a new endeavor and we are essentially creating a course that is quite different from anywhere else in the world and also quite different from what they teach in Durham. And I was able to leverage on their enthusiasm, their passion, and that's how the course started. So these are teachers drawn from very diverse sources, the commonality being that they're all senior clinicians and all have a good track record of teaching. Oh, Duke-NUS students are very special students. I think as a whole, they tend to be highly motivated, very enterprising, self-starters, and they bring a lot to the school because they come from diverse backgrounds, diverse disciplines. And when they come here, of course, in the normal body course, some of them suffer a lot of angst because they're used to being very good students, and suddenly they encounter subjects that are very, very tough. And as most good students are, they want to do really, really well. But by the time they come to the clinics in the second year, they would have regained their self-confidence most of the time. And I think most of them continue to do very well. And as a whole, I think they're all destined to be great clinicians and great clinician-scientists. Medicine is a calling, actually. I think a person should do medicine only if he feels that this is something he wants to do, because it's really a very tough life, you know. But after having made that decision to do medicine, I think one of the best places to do it is probably in Duke-NUS, because you get a very innovative program, very progressive program. You get great faculty, and you're also in a part of the world where I think after you graduate, where there'll be great opportunities, you know, because I think this is a part of the world where the whole biomedical field is really expanding and growing at a very rapid pace. So great opportunities for clinical development, great opportunities for biomedical research developments. So if you want to be a doctor, I think this is a good place to start, Duke-NUS. Okay, I shall be very blunt. First, you must have passion. It's very important. Secondly, I think there must be compassion, because otherwise you are really in the wrong field. And thirdly, you must be able to work very, very hard. You know, these are the answers.